Rapid Dose Therapeutics here in Burlington announced today that they are moving forward into the next stage of putting a COVID vaccination into their trademark tongue strip.
So one of the things we've been working on with McMaster for over 4 years is the ability to put various active ingredients into the strip. And the ability to drive customer experience and innovation became forefront. Looking at the global pandemic, things that are going on in rural communities and third world countries, it drives change. It will increase the customer's outcome and their health and wellness and their well-being for all.
We have shown that we can take these quick strips and dissolve our spike protein from the coronavirus and an adjuvant and put it into mice and elicit mucosal immune responses that will protect the animals. So the animal experiments take a long time, as you can imagine. In humans, we have a phase 1 trial, a phase 2 trial, and a phase 3 trial, but that's after the animal work. So our preliminary data looks very good that these RDT strips will be able to vaccinate people against coronavirus, a bacteria or virus that infects a mucosal surface. And mucosal surfaces are in the nose, in the mouth, the throat, the vagina, and the rectum. Those are all mucosal surfaces. So if you have an infection that infects a mucosal surface, you want to induce mucosal immunity. So by putting these strips in your mouth, it's exposed to the sublingual under the tongue and the buccal on the side of the cheeks. And that stimulates mucosal immunity. All right? So that's very, very important for mucosal infections, is to stimulate mucosal immunity. And this product will do that.
Delivering a vaccination through a strip has numerous benefits over the traditional injection.
Reduction of the cold chain, the impact on the practitioner, the healthcare worker that could be exposed through giving the needle and the vaccination. You look at the long-term care facilities, the ability to remove that issue of infection or contamination within the environment. Disposal of used needles. The carbon footprint that is created right now through the environment, delivering billions of vaccinations is paramount.
While the strips are still in development, in the future they may still be able to help control COVID-19.
When you start looking at the variants coming through and what the future could bring, nobody has a crystal ball. However, we do understand that there is various variants coming out in the future and the ability to microdose. When you start looking at event-based immunization, it could be for travel. You could have a strip for your kids to have in the morning before they go to school. You can microdose various ingredients to adjust or to interact with that current variant that's in the marketplace. With a simple logistics system that is easily done, more remote locations can be handled through the transportation systems, and we think that's a game-changing opportunity for the world.
And the next step is, well, what other infections can we use these strips to vaccinate for? And I mentioned human papillomavirus, chlamydia, even influenza. As Mark Upstell mentioned, the sky's the limit. These strips, dissolve in the mouth. No needles to dispose of, no injections, no staffing issues, no cold chain. All these good things work with this approach to delivering a vaccine.
Reporting for Halton News, I'm Nikki Wesley.